Welcome. My name is Dr. Joshua Malley. I'm a board-certified ophthalmologist and award-winning vitreoretinal surgeon in Sarasota, Florida. I'm also the founder and CEO of Malley Enterprises, and I serve as the Retina Medical Director of the Macular Degeneration Association. Thanks again for joining me on another episode of the Retina Project. I'm really excited to be with you guys today to talk about the upcoming ASRS meeting in July. There's a lot of hot topics that are going to be presented there, and I want to share my top 5 topics as a preview to the ASRS 2022 annual meeting. First topic I really am looking forward to seeing is about all the innovation in wet AMD treatment. Certainly, I think I'm excited to see more data and more in-depth look on Vabysmo, as well as Susvimo, which have been recently FDA approved and now kind of real-world clinical practice. I'm curious to see if there's any more continued data and more looking at patient outcomes with these treatments. Additionally, I want to get a more in-depth look at the high-dose Eylea treatment as well that's being looked at in clinical trials. So a lot of innovation in wet AMD, and certainly there will be a lot of information in the ASRS meeting. Second area I'm excited to see is the dry AMD status. As many of you know, there's currently Apellis' medication. It's the C3 complement inhibitor is being looked at for the treatment of dry AMD, and it's being reviewed by the FDA. So certainly I'd love to see a closer look at the 18-month data and more in-depth analysis, looking at that to see if any additional findings can be gleaned from the data set, as well as an update possibly from Iveric Bio with their C5 complement inhibitor Zimura, and see if there's any additional data there for dry AMD. So certainly very exciting to have potentially new treatments in a disease that we cannot treat before with anything that's FDA approved. So very exciting to see that now. The third area I'm looking at in the ASRS meeting is an update on gene therapy. I haven't heard much of updates on gene therapy. We have a lot of trials going on with inherited diseases, and it's really I haven't heard any real significant updates of recent. I'm hoping that to see some new releases of data on several inherited retinal disease gene therapy treatments that have been going on. So love to see an update from those companies in regard to the new gene therapy treatments. The fourth area that I'm interested in seeing is really artificial intelligence and telemedicine. Certainly the one particular device, the home OCT. I'm looking forward to seeing an update on any additional trial data, as well as the potential of how home OCT may revolutionize the way we monitor patients that are receiving anti-VEGF injections for wet AMD, for example. So it's really exciting to see that technology and the progress that they made on their front. And then finally, I'm really excited to hear a new update on the PAT survey. So as you know, PAT survey stands for Preferences and Trends Survey, which is more than 1,000 ASRS members participate every year in this survey. It provides a yearly snapshot of the ASRS members' preferences on a wide range of issues, from medical, surgical, and socioeconomic topics for retina specialists. So it's always nice to hear an update on how all our colleagues are practicing the art of retina. So certainly it's always nice to see that update and getting all the new ways that people are practicing in different parts of the country. So I'm really excited to see that, and that's always a very hot topic and very exciting update that we always get every year. So that's my top 5 things to look for at the ASRS meeting coming up here in July in New York City. Hope to see you there. Thanks for joining me on the Retina Project.